4 problems Oklahoma home healthcare agencies face. Courtesy of EMSCO Solutions, Information Technology Guide for Oklahoma City Home Health Care Organizations. The home health care industry in Oklahoma is growing at an impressive rate, with new agencies and the businesses that support them increasing in number every year. Like all industries, however, it faces problems and challenges, such as Medicare cutbacks, staff retention, and the dark side of technology. This article explores 4 of the biggest issues that Oklahoma home health care professionals are facing as 2016 looms ahead. Finding qualified staff. Increased demand presents healthcare agencies with the challenge of finding and keeping qualified caregivers. Current estimates suggest that the demand for trained staff will exceed availability for a few more years. Salary is also an issue. Fair compensation is the key component to retaining a capable workforce. However, not too long ago, the Lubbock Avalanche Journal ran an article revealing that close to half of all home health care workers live at or below the poverty line. That has to change if the industry is to maintain its integrity, but many agencies just can't afford to pay more. Medicare cuts. The United States is home to an aging population. By one estimate, approximately 17% of the American public will be 65 or older by 2020. This means that close to 50 million people will be more reliant on the healthcare industry 5 years from now. Of that total, 70% have indicated that they intend to stay in their homes for as long as possible. In other words, 35 million senior citizens will need home health care. Despite this anticipated demand, the Affordable Care Act has called for major reductions in Medicare payments for home health care. So far in 2015, $60 million has been cut, and the Centers for Medicare and Medicaid Services have recommended that there be additional payment cuts of $350 million in 2016. This trend poses a serious challenge for future home health care accessibility. Techno shock. Technology has revolutionized the home health care industry. Slow, outdated PCs have been replaced by portable, efficient equipment such as tablets and smartphones. Home health monitoring systems connected to hospital networks have provided valuable support to patients who prefer to remain at home and the staff who assist them. Learning to correctly and efficiently use these innovations takes time and effort, however, and some agencies adapt more swiftly than others. The ones that aren't as quick to embrace new systems are hindered by the cost, the hassle of revamping the older setups, or both. Data breaches. Cyber thieves target medical records because they contain enough personal information to create a full identity. In April 2014, the FBI stated that the healthcare industry is at serious risk for major breaches because it is not as resilient as retail and financial sectors. There are several reasons why home healthcare agencies are particularly vulnerable to hackers. They include vague data protection regulations, the mistaken belief that medical data is not attractive to criminals, and limited IT security budgets. Bottom line, despite high demand, the home healthcare industry is like many others in that it faces unique challenges that could damage its integrity if not adequately addressed. Successful navigation and handling of these issues are critical to the quality of current and future service delivery. Does your home healthcare agency experience any of the problems outlined in this article? If so, how has the agency been able to address them? Let us know your thoughts in the comments box below. And to follow up on the tips introduced in this article, be sure to download your free Information Technology Guide for Oklahoma City Home Health Care Organizations. You can download a copy of this guide while it's still available at okchomehealthitguide.com. Thanks so much for stopping by and tuning in today to learn all about 4 problems Oklahoma home health care agencies face.